NGO Trinayani presents Building Back Better. Skill development of mainstream school teachers on suspecting learning disabilities using the ANUMAAN screening tool. 20th and 22nd June 2022. First session on the 20th of June 2022 on procedures and ethics in school screening was conducted by Dr. Asmita Huddar, Principal, Hashu Advani College of Special Education, Mumbai. The sixth session in our series, in our Building Back Better series, which we started in December 2021. And it's a year-long series with the concluding program in December 22. This month, MenCap celebrates the Learning Disability Week from the 20th to the 26th week. And we just took up this opportunity to be able to highlight this very important disability that is now being recognized by the Government of India in their Rights of Persons with Disabilities Act 2016. And since I have the pleasure of having these two wonderful friends on board, and the fact that they have come up with something that I thought greedily I should be a part of getting people know about it. So Dr. Asmita Huddar is here with us. Dr. Apurva Panshikar is here with us. Today, of course, the session is with Dr. Huddar. And she's going to be actually talking about ethics around screening. And the tool that we have been talking about and really promoting and getting people excited to know is called ANUMAAN. It's a school screening tool which is developed at Hashu Advani College of Special Education, of which Dr. Huddar is the principal. This was developed in 2021. 8 experts, and that's very important because it talks about 8 disabilities, and it talks about 8 disabilities by having 8 experts on board for the discussion and the resulting screening. Thank you so much, Dr. Huddar, for being part of the Building Back Better series. Over to you.
Ethics is part of life, right? And whether professional ethics or personal ethics. So as I describe the procedure of this particular tool that we have developed, ANUMAAN, I will also be talking about the ethics involved, which I'm sure we all will, assimilate and try to implement when we actually work on this tool. Okay, I'm sure you can see my screen. Yes, a big thank you to Trinayani and Ritika for doing these wonderful sessions and many more things that, in Marathi, we have one word, dhadpadi, somebody who's all the time active, very goal-oriented, and Ritika is one of them. So a big thank you to Trinayani and her team, of course, for doing all these wonderful things which generally the school setup or educational setup wouldn't think of. So somebody's there to take the flag ahead of advocacy. So thank you, Trinayani, for that. Okay, one announcement, just an information that I would want to share with everybody now that everybody is here and maybe a little more curious about special education if you're not already a special educator. Then we always start any session by spreading the message that special education is no charity. It is a full-fledged, fulfilling career option. And graduates can take it up. And it is not, like I said, charity or to help poor children with disability. No, it's all about ensuring their rights in appropriate environment. So B.Ed special education is the option many of you or your relatives, neighbors, or other groups can think of. So Hashu Advani College of Special Education, a quick word about it, is an aided college affiliated to University of Mumbai and recognized by RCI. And we offer B.Ed learning disability and B.Ed hearing impairment. Currently, the online application forms for B.Ed CET is in process, and 7th July is the last date. So please spread the word. I request you all to maybe click a photo of this slide and you can share it with others, those who could be interested, who have done graduation and is looking for a good career opportunity. Okay, so over to today's topic, and that's a school screening. Quickly, we'll see the concept in a very oversimplified manner. And then we talk about the procedure and we'll try to understand our role in it. Our role, by that I mean the educators, general educators as well as special educators to an extent. But I assume that most of the people here are from mainstream setup, though I see some of the special educators as well. But I'll focus so that, I explain in a simplistic way and application wise. I mean, we are not going to go into any kind of theory. So to put it very simply, what is school screening? Is the process of checking the possibility of each student having or not having disability in a mainstream school. So as you can see, the word possibility is highlighted here because through this process of screening, we are not going to come to conclusions or diagnose or assess. We are just weighing the possibility of the children having disability. Now, at this point, any disability. I know the focus of these twin workshop is about learning disability, and I'm sure Dr. Apurva Panshikar in her session is going to be more focused with learning disabilities and issues. But I'm trying to give you a broader picture, broader procedure, and then maybe in the next session, you will understand more about suspecting learning disability. So right now we are not talking about any particular disability. We are talking about any disability. For that matter, we are talking about identifying the special education, special needs of the children. So whether disability or no disability, there could be special needs of the children which could be addressed. Okay. Yeah. So why school screening? It is more to do with the attitude of the school authorities and teachers and all those who are involved, that why do we run this extra mile, why do we do this? That's not the part of the system, or that has not been the part of the system so far, or no guidelines tell us to do about it, or is that my role, or why would mainstream schools do it, vagara, vagara, vagara. So here are the reasons. Why do we do school screening? Why do we run a process where we find out whether there is any child with disability in the school or class or not? How do we suspect it, and why do we do that? So it is much needed if we see the incidence of disability and we see the big number of students whose needs are currently not addressed in a school system. So it's high time that we figure out what is the. Is somebody saying something?
Yes, ma'am. So sorry, Shazia here. Ma'am, the slide is not showing on the screen for some reason.
Oh, is it?
It's still on the first picture.
Oh, is it? Okay, but I am going ahead. Okay, should I screen share again and check?
Yes, that'll be better.
Oh, okay. Let me see what's happening. Oh, good you told me, Shazia. Thank you for that. You can see my screen now?
Yes.
Okay. What do you see now?
Yeah, school screening. Yeah, meaning of school screening.
Okay, cool. So I just talked about it, and as you can see, possibility is the word highlighted, because once again, and I'll say this again and again, because we are not going to assess and diagnose. We are just checking the possibility. Okay, so we are just seeing attitude wise why school screening is needed and why schools should go for it. It is very simple and very easily doable. No rocket science involved here. Once you have your tool in hand, this screening tool or any other screening tool. At this point, I'm not talking about ANUMAAN as such. Yes, we have evolved ANUMAAN, and not many tools are available to suit Indian conditions. And I think in Marathi, so this could be first of its kind, not sure. But then what I'm saying is any screening tool that you may think of or you may get hold of, you could use it. What is important is screening procedure is extremely simple, does not need involve any professional help or fancy people and lot of money, funds and all. you just need the mindset and you just have to feel the need for it कि ये करना है, इसकी आवश्यकता है. It works well with the schools because any school, whether so-called merit governed schools or easygoing schools, do have children with question marks. Something is not working well with those students. So any school would be interested in finding out what's going wrong, why some of the students are not in the loop of learning. It works well with the students, obviously, because their needs are identified. Nobody really knows what the struggles. I don't know whether you've heard the word struggling learners. So those who have special needs and those who have developmental deviations for whatever reasons, with whatever degrees, they're struggling hard to cope up. So it really works well with the students to get things sorted. That is there any reason for the child being lazy, moody, inconsistent, or whatever we label directly or indirectly. So it works well with the students. As I said, not much of cost involved in this. If you have tool and if you have enthusiastic teachers who want to run it, and it's just a matter of some months. I'll explain the procedure, and one has to be consistently using this over a period of time, and then you will have your list of students in hand whom, once again, I repeat, we will not assess or label or diagnose, but we will refer them to the for the further assessment. So it is cost effective, no cost involved practically. And yes, it ensures you some brownie points. You can, it's about brand name of the school, visibility of the school. You can flaunt these efforts in the public domain. There could be accreditation systems for schools, quality management systems for schools. You can impress your trustees. So, I mean, this is a good activity, which is much needed. So if carried out, if there are systems of quality control, quality measurement, that will definitely win you some brownie points. Not that we do things for it, but some additional thing. So the question here is not why school screening, but why not? When it is so much needed, and for many efforts we need funds. Here I'm saying not funds, not much of funds are required. Efforts wise also, it's quite easy going. So I'm very happy that all of you have joined and somewhere have interest in this area of school screening. So let's just quickly see conceptually a little more in depth about what the word screening is. And I'm going to kind of say it again and again, because I really, really don't want to be the instrument to mislead you. Many a times it happens that, there are some teachers or schools who end up thinking that, okay, I can, I know that child has learning disability. Oh, I have done 1-2 hours workshop. As we all know, after Tare Zameen Pe, there was overdiagnosis. So somewhere, you know about it, you feel, that's a common sense. Now I've understood it. Now I know this, this Neha has learning disability, or this Pankaj has ASD. So let's not do that. And that's why I'm going to repeat that point several times. So these are the neighboring concepts: test, diagnosis, assessment, intervention, identification, suspecting the disability, therapy, rehab, certification, screening, labeling, referring. So the whole schooling and the intervention begins before that. All these things happen. And in terms of the role of teachers, mainstream teachers also, and to an extent special educators also. Special educators will be part of the teams which maybe do the assessment and diagnose and label. But mainstream teachers, I think, have to understand their role very clearly, that their role is to suspect. आशंका लेना कि विकास में कुछ गड़बड़ है और इसका आगे मूल्यमापन की आवश्यकता है. So that's something we need to focus as classroom teachers. And screening, after suspecting comes screening. Okay, I'm going to talk about it. How do you filter the students, with what procedure? But okay, I suspect that there is something quote unquote wrong with the child, developmental deviation. He or she doesn't fit into what is expected out of the students. So you suspect that, then you screen with the checklist that we will be sharing. And most importantly, we will be doing referring. We'll come to that. But we will definitely not diagnose, will not do any kind of assessment, diagnostic assessment. No intervention as such. Identification, again, coming to a one-line conclusion of the assessment, that's identification. We will, educators will not do that. Individual therapy, not expected by you. Okay, one-on-one sessions we can take to support the child and the process, but therapy as such, no. No rehab activities, no certification. Obviously, the school is not going to give any certificate or a letter or a return statement about the diagnosis of the child. That will be somebody else's role. And again, we will understand that clearly. Labeling as well. We will not do any kind of labeling before the diagnosis and identification report is in the hand. So here we are. We are just going to suspect the deviations, do the screening with the checklist that we share or any other checklist, as I said. And most important, what do we do after the screening and what do we do after we have, say, 5 students listed that those who need further assessment is referring, sending them to appropriate center, hospital, clinic, whatever setup where further detailed assessment will be done. And obviously certification and diagnosis and everything will fall in place if the child has disability, certifiable disability. So we will focus on referring. Let's not stop at the point of suspecting and screening, and that's really very harmful. Now there is something, some developmental deviations are there, and yet you're not going further to find out what those are and what are the needs of the students. And to address those needs, if you're not doing anything, then there's no point of that screening, because in fact it is going to be harmful. Because now every time you teach the child or look at him, give eye contact to her or evaluate her, every time you're going to think about in whatever way that there's something wrong with the child. So referral has to be done and further assessment needs to be done. That's absolutely essential. If we are unable to do that, then let's not do screening. Okay, so what is teacher's role? Basically to understand the needs of the students, and to understand that we need to know the diagnosis, whether the child has disability, child does not have disability, child has mild disability which is not certifiable. So he or she may have special needs, but not the certificate. So whatever is the scene with the particular child, we must understand. And obviously our role is to include them in school. The whole, the system is run ultimately for the goal of inclusive education, sustainable inclusive education in true sense. And then accommodate them in the classroom, understanding their the concessions, exemptions, facilities, and reservation, 4 different things which are due to them, which are, they are entitled due to the acts in the country, and also the systems and schemes of various boards and universities and colleges. So how do we accommodate them? By providing them the exemptions, concessions, facilities, and reservations. Those are due to them. And one thing we will definitely not do is to, segregate them. And why I'm saying this, why do I have to say that? Isn't that obvious that we don't segregate them after the diagnosis? Yes, it is obvious, but this is what generally seen that happens. Once a school, a mainstream school knows that the child has disability, the first instant reaction is send him to a special school. Oh, okay, then, change the classroom. Or now in 8th, let's try 7th standard for him. So that kind of a thing, segregation, isolation, and unnecessary underestimating the student must not happen. And that shouldn't happen because of the screening. Like I said, फिर तो screening का कोई मतलब ही नहीं हुआ. If we can diagnose and if we know the case profile of the student and we are in a position to support educational process, then screening का मतलब बनता है. वरना सिर्फ लेबल लगा दिया and then needs are not addressed, तो वो लेबल नहीं था तब the child was better off. So yeah, we will concentrate on including the students, and I'll come to talk about participation of the students also, and then accommodate them. Okay, so here is that tool ANUMAAN, which we have developed as a part of one of the conferences. We wanted to talk about school screening, and then we realized that there isn't any readily available school screening tool. So, all the resource persons, we got together and we decided that let's develop a tool and then give the teachers training on that. And this was training for the mainstream school teachers. And I'm very happy to note that from interior Maharashtra, Raigad, Nashik, Latur, I guess, there were around 2,000 teachers who participated in the learning of this tool, how to apply and implement that. So basically the procedure involves 2 steps. First is cross disability screening. That means we don't want to know which disability, but there could be special needs, or there could be disability existing in that child. So first we just filter the students, those who have or may have developmental deviations. So this is cross disability, the first step is, and this is just to identify the special needs. And these are general indicators, like they will not point to any particular disability, but they will just filter the students, again, only for the process of knowing them better, only for addressing their needs better. So first will be the general indicators, and then specific indicators. And as I said, in the second twin session, you will get to know more about the learning disability and how to suspect that disability and suggest further assessment. Okay, so the scheme of action here is, assume that in a mainstream school, there are 70 students in a class. There is a poster along with this tool, and we request the teachers to put up this small A4 size poster inside of the cupboard in the school, in the classroom. It need not be on the notice board, or it need not be in front of the students. We are going to talk about dignity and respecting dignity of the students. So that's the reason. So in the inside of the cupboard door, we can paste this poster. This poster has 7 indicators. 7 indicators which suspects developmental deviation. Again, not any particular disability, but overall general, somewhere something is not correct, that kind of a thing. So once, and then there are, I'll show you, then there are, filters, 7 filters there. The teachers are supposed to seriously, sincerely observe all 70 students for a span of 2 to 4 months. And then as per the indicator, just write the names below the indicator. Whatever the name of the student is, where the teacher suspects that there is a developmental deviation. So if that exercise is done, say after 3 to 4 months, most likely that there are around 10 to 12 names on that poster out of the 70 students. Again, this is extremely rough estimate, and the numbers really don't mean anything here. If of a class of 70, you find only 5 of them with whom you really want to do the checklist and assessment, then that's fine. If it is 20, that's fine. General idea we are giving so that, we don't want, see, ideally, let me tell you something. Ideally, every student has the right to undergo the screening procedure. But because we have big class sizes, and maybe it is rather difficult or demotivating for students to maintain 7 checklists for 70 students, then we are suggesting a practical way out is, okay, let's filter the students first. Maybe all the students do not need the complete checklist assessment. So from 70, we come to around 10, 12, 15, 20, whatever is the number. Those are filtered students for 7 indicators that will come to. So we'll look for 7 indicators, and wherever the teachers feel that, okay, at least for, even if it is for 1 indicator, the student's name has come on the poster, then that student needs a case file for checklist. Again, we haven't yet reached till the point of assessment. We are just now saying from the generic screening tool, that is a poster. Then we move on to the specific checklist, which is disability wise, condition wise. And then, as you can see in the white box, screening checklist to be filled up for the filter students whose names have appeared on the poster. So suppose if I decide that in June I start, I paste this poster and I start looking at the students, their behavior systematically, sincerely, making my notes. Nothing extraordinary or nothing beyond the syllabus or nothing after the school hours. Just when I teach, I observe, and then I put the name as per the indicator on the poster. And when the names appear after say 3-4 months on the poster, then I prepare a file for each of those students who are there on the poster, their names, and attach empty screening items in that file. And then again, I spend some time, say around 2 to 3 months, to observe and then fill up the checklist. The checklist or the poster should not be done in a day's or even in a week's time. Yeah. So we are requesting teachers to go a little slow and observe carefully so that our observations are not generic and rather specific. Then see the around 10 to 12 students will be there for whom we prepare the files, for whom we will do screening for 7 conditions. After that, there will be again around 3 to 4 students, number is just assumed here, who may need further assessment. And other students may not need further assessment. But those who do not need further assessment, there are scores given and there is interpretation given. That you will understand in the next session when Dr. Apurva Panshikar explains that to you. So all 7 screening tools, which we will not be presenting currently, we are just going to concentrate on learning disability, but all 7 conditions have scores and have given the interpretation at the end. So score XYZ, what is the action point? Score ABC, what is the action point? And for all the conditions. Okay, so now what are these 7 pointers on the poster which the teachers must look for? As I said, these do not indicate any specific disability, but it generally gives indicates developmental deviation. So the first point that the teachers can be very careful about is observing eye contact. The poster gives you the whole line and the point about eye contact. Here I'm just going to quickly touch upon the points. And I'm sure, I mean, all those who are teachers here did not have to be told about the theory behind this. So we are going to observe the eye contact behavior of the students. And if we find something deviating from what we generally expect as a teacher, or in by default comparison with the other students in the class, then we will write the name of the child on that poster. Then again, one more area that we observe is participation in the class activities, whether the child is withdrawn or talks too much, or is away from the class, hesitates, or wants to be alone, or inconsistent, sometimes very active and jumping around and sometimes not. So whatever is the participation of the child in the class activities, curricular, co-curricular, extracurricular, during exam, during meetings and celebrations and whatever. So one of the other areas like eye contact, we observe the participation in the class. Then we also look for frequent errors. Again, the poster explains frequent errors in what? So in reading, in writing, in speaking, in listening, in all 4 areas, if there are frequent and consistent errors, which again, let me again make it very clear that all this is rather subjective in comparison with the other students. So suppose if I am teaching a 7th grade students and I have 45 students in my class, maybe you are unable to pinpoint what exactly is different in this child, but you will notice if you know the areas, and you will be able to separate or filter out that child for further assessment. So frequent errors, if you notice in comparison, by default comparison with the classmates. Then there are students who lean forward or prefer front benches, or come ahead for concentration. So look for that behavior. Obviously, I mean, most important that teachers never miss is deviated appearance and movement of face or limbs or whatever. So that definitely the teachers are quickly aware of because of the visibility of the point. So those students also will be, their names also will come on the poster. Deviated behavior in behavior and socialization. The interaction of the students with the classmates is also one of the areas that we look for. What are the social dynamics and how well is the child part of the social dynamics in the classroom. And also we've kept a margin because maybe 1, 2, 3, 4, 5, 6, nothing is wrong. But there is a child who's always labeled by everybody, not maybe openly, but in the minds of the teachers or in the minds of students or the, captain of the class, that he or she is the one who's dull, lazy, moody, aloof, alone, or inconsistent, arrogant. So all these labels which we generally use in whatever language that we are comfortable with. So here is an opportunity to find out that if the child is dull, why is he dull? If the child is lazy, why is the child being labeled lazy? Is there some other conditions which are beyond the child's control that is making him come across as lazy, moody, aloof, or dull? So these are the 7 indicators, as I said, the general indicators, which will be on the posters, and a span of 2 to 4 months where the teachers systematically, sincerely, and consistently observe all the students and filter out students which may have deviations in these 7 areas. So this is the poster looks like. There are 7 indicators given, 4 on the first, the upper part of the poster. And there is a space for writing the names. And these are the bottom part of the poster giving the rest of the 3 indicators. And then there are spaces for the names to be written. Once again, this poster will not be displayed on the notice board or in front of the students, because we do not wish to compromise the dignity of the student, and we don't want other students to, label the child or tease, or we know how amoral students can be. So we don't want to give them a chance to, tease or underestimate this child, which we are trying to filter out. So this filtering process has to be extremely confidential, and that's the ethical part of it, that how we hold on to our teaching without students knowing about it, that what is happening. And obviously we will let the family know at the appropriate time. Again, that is also ethical part of it. Also a quick run through that how we are we have to move from the poster step to the checklist step. As I said, that on the poster, if there are around 10 to 12 or 15 names, then we will create files for each of the students. We'll file the unfilled checklist there, and then the teacher will get into the action of filling the checklist again over a span of at least 2 months. Obviously, the first step is consent, absolutely important, at times neglected in our country, but we need to take consent from the family parents that, for the betterment of the child and for the learning process to be smoother, we need to observe the child carefully, and the observations will be marked. And such consent has to be a written one, and it has to be an informed one. So parents know what is happening. They are part of it. They might also give remarks and inputs completing that checklist. Then open a file per student. enter basic information. I'm going to show you what basic information can be entered. Now that's minimum required, but I mean, you can evolve your own pattern of demographic data that you want to collect. Then file blank checklist as per the needs of or all 7. Okay, so there are 7 checklists which are given in the tool ANUMAAN. Now the question is whether for each child all 7 checklists needs to be filled up or not. So it's no. It's not necessary that for all students you fill up all 7 checklists. If you're very clear that okay, there is something wrong about the hearing because the child prefers sitting on the first bench, or comes ahead while talking, or pays more attention to the face of the teacher or the one who's talking, and there are clear indications about mild or moderate hearing loss, then you will concentrate on only that checklist, which is about one is about speech and one is about hearing. But if we are confused and don't know which direction the indicators are taking us, then all 7 checklists can be filled up for the students. So again, that is a take that the teachers have to decide. Observe and fill the checklist as an ongoing activity. As I said, it will not be, okay, I have to finish the task by Monday, let me complete it on Sunday. That is not how it is done. Then assign scores. So once the checklists are complete, maybe after 2 months or 3 months, then there are scores assigned, and then there is interpretation given. So then what do we do with that interpretation? There are simply 2 things. One is refer the child ahead if the score indicates that the child needs further assessment. So from suspecting to screening to assessment. So our role here, as I said, is refer. So refer them to the clinic, hospital, centers, wherever the diagnosis is done. But even if the child clears the checklist and there is no further assessment needed, is our conclusion, then also it is always better for the teachers to keep on observing. That's absolutely important. I think this PowerPoint can be shared with you all. It is also available on slideshare.com, so you can access it anytime. At any point, if you feel like, you can take snaps of these slides. So this is the information, that minimum information that you must file before you start the observation, and after you take the consent from the family, and of course consent from the school authorities as well. So teachers, when you plan the screening tool and screening procedure, do inform and take approval from your higher authorities, supervisors, principals, trustees, whatever, and of course the parents. Yeah, so this is the minimum information that you can collect. Okay, now about do's and don'ts related to the procedure of this screening. So as I have said, do not fill checklist in one go. Span of observation must be 2 to 4 months. Now, as I said, 2 steps. So when we have posters on our cupboards, then again the span is 2 to 4 months approximately. And once the students are filtered out and then checklist needs to be filled up, again span of 2 to 4 months. Keep the file handy so that you can enter observations there and then. You notice something about some child and you feel, oh, that's the point in the checklist. So do not, keep the file where you are unable to quickly access it. Again, let not the students get the hang of it or get to see it, because we don't know how they use this information till they are trained and oriented about the needs. But it has to be kept handy so that the teacher remembers, okay, this is the name of the child and this is what I observed. So let me enter it with the pencil, and maybe for a week or 2 I observe and then enter it with the pen. Do not share the details or show file to other teachers, other parents, students without professional reasons. So if you need to show it for professional reasons, then still okay. But again, one must take consent. And one must think of the dignity of the child and the consequences of you sharing this information. So whenever it is professionally needed, we must share it, not to hide it. But when it is not needed, we must not, because we don't know how the receiver is going to respond to. As we know, there are so many negative mindsets and attitudes which are common. So we don't want the student to face that. And do enter remarks along with the tick marks. So checklists are basically, you ticking the points, but then there is a space for remarks, and do write the remarks, because when you refer the child for the assessment, you can send across a copy of this checklist, which is absolutely important for those who do assessment, and your remarks are going to be very, very useful. So that is one of the points. Okay. So what about those students who were suspected but could clear the checklist? That means those who, when you did the scoring and found out that the interpretation is this child does not need the further assessment. So what happens that time? So first and foremost, again, discuss it with the family. Even if you don't refer the child for further assessment, and we say that the child cleared, but because you suspected it, there could be some of the reasons, there could be some of the special needs that the students may have. So do not think that the child, has quote unquote passed the screening and then I don't have to inform the family. Keep the family in the loop, because they have inputs in this whole process as well. So that is also extremely important. And then continue observation. I think once that mindset is there, that the teachers start observing the students for these pointers, then it is kind of a never-ending procedure. Somebody needs to mute yourself, please. Kuch awaaz aa raha hai beech mein. Yeah, thank you. So the observation continues. That's again very important. Although cleared the checklist, but if you still suspect developmental deviation, refer the case for further assessment. Again, this is very important. Even if your checklist indicates that the child does not need assessment, but if you feel, your heart feels that, oh, okay, no, I can't be wrong, the checklist is not catching the point which I suspect, then do not hesitate sending the child. As I said in the very beginning, that ideally, all students must get, it's their right to undergo screening, so that if there are any early symptoms, or even there is a milder degree of deviations, those are acknowledged and mapped. That is absolutely necessary. But because of the bigger, larger size of the classrooms, and because teachers are already overburdened with so many tasks, we kind of filter the students. But beyond this filtering and beyond this checklist, if the teacher feels that a child needs assessment, then it is a good point to go ahead and get the assessment done, convincing the parents and referring the child to the appropriate center. Okay, about the informed consent, there are a few points. Schools can evolve their own consent formats where the parents sign, but some of the pointers which you must not miss, and because again, that's the ethical side of screening. Again and again, I'm saying that, our screening should help the students and should not create problems for the students. And that's the biggest risk, and that is the biggest fear. That we diagnose something and later on we don't do anything about it, and in a way the family and the child feels we were better off without diagnosis. At least we were considered quote unquote normal, and we were part of the activities, which as the child is losing on to that. So that shouldn't happen. What are the various points that the parents have to give consent, and schools have to kind of assure these points. So the parents can say that I'm giving consent for the following points. First is teachers observing my ward and keeping notes on that. Again, one has to define who will have access to that. We'll have to make it clear that whatever record keeping or note taking that has been done, the access will be restricted only for the academic purpose and only to the school authorities and the family. And of course, to others only for the professional reasons. Sharing the notes and records with other professionals for professional reasons. Referring the case for further assessment. For this also we need to take the consent of the family. Let's just understand that actually families are the ones who will decide whether they want to go for assessment or not. Obviously, teachers will be there who will guide and recommend and facilitate the process, but not without the consent of the families and not without keeping them in the loop. Again, there many times there is kind of a denial, and parents don't want to immediately accept, or parents don't want to immediately go for assessment. So there will be a procedure where teachers with patience will explain it to them why it is needed. Like we always talk about at our early intervention center for hearing losses. If the hearing loss is not there, then it is not there. The assessment is not going to bring that hearing loss in the child. But if it is there, then it is better to know early so that we can plan things. So that's how I think teachers can ease out the whole conversation and explain the need for further assessment to the parents. And inviting participation of, oh, okay, this is something absolutely important. That once the teachers know the deviation, even before the child is labeled or diagnosed or gets certification, and even after that, the child's participation in the classroom for educational purpose or co-curricular activities or for any social academic dynamics in the classroom should not be decreased. The screening and the diagnosis should not be an instrument to minimizing the participation of the child from his side and also from the other's side. And what are the school's commitment? Again, this is again an ethical side, that information records saved will be used for purely academic and research purpose. Confidentiality and dignity will be maintained. Dignity of the family as well, not only of the child. Not to ask for charges for school screening. Again, that is one of the ethical recommendations, that this shouldn't be looked at as a fundraiser kind of a thing. The outcome of the screening procedure would not impact school enrollment. Again, if the child is diagnosed having special needs or gets a disability certificate and diagnosed to have one of the disabilities, in no situation enrollment should be impacted. So no situation where after the diagnosis, schools tell families to look for special schools, look for other school or any other alternative like open school and all. So the enrollment and the education continues, and that's again is extremely important. And that's the risk we are taking by screening, that we do not want to minimize the participation and do not impact the enrollment of the child. And school remains committed to quality education and access to all. Whatever is the status of the child, whether the child is filtered out or not filtered out, whether the child is found to have developmental deviation, found to have disability, no disability. We all believe in quality education, which is accessible to all. So that mission we have to go ahead. It's 7, yeah. So I'll wind up in 5 more minutes, Ritika, Shazia, and then we'll take the questions.
Yes.
Yeah, I have been repeating some of the points. So that's kind of a summary about not compromising the dignity of the child. Again, if I tell you, do you gossip about your students? Obviously, the teachers are saying, no, we never do that. But we all are human beings. That may happen. So how can we consciously hold ourselves and not, what do we mean by gossip is loose talk, referring the child's case to somebody who's not, that's not professionally relevant. So let's not gossip about the child's status and our observations and our records. Let's not point fingers again, literary and literally, So that child with whom I'm suspecting LD, let's not label a child like that. Let's not address the child, just give this notebook to that child with specs or the child with learning disability. No, children have names, and I mean, that's the least that we can do is address the child with the name that is being given to him or her. Do not let participation decrease, as I said already. Do not let other students, teachers, parents tease or underestimate the filter students. And that's the reason we said that the poster has to be inside of the cupboard, not accessible to other students, because we don't know how students use that information or misuse that information. And if the students are like third, fourth, fifth standards and onwards, then about assessment, about diagnosis, about the suspecting developmental deviation, we can talk to students themselves. Of course, with the family as well, but then let students themselves know from us in a very professional and patient way that what is the whole process about and how it is going to be helpful to the child once we know what is the situation. So what if actually the child gets the disability certificate and diagnosis? So obviously we will try to understand the diagnosis, what it is, what does it mean? Google is God, so every information is there. What we need to have is an appropriate and positive mindset. Understand the special needs. So, okay, the child has been diagnosed as low vision. So what does that mean? And what are his or her special needs? So what is how my role changes, knowing that there is a child with low vision in my class? So how do I address the needs and how do I ensure the access? Find out about concessions and exemptions that they are due and inform the parents about the concessions and exemptions and let the family decide whether they want to go for it. It's not that there are exemptions and concessions, why not take it? No, these are consequential. So we must use it, the families must use it when needed and in the degree needed. So orient the classmates again, that's a standard practice suggested, but take a stock of the situation, see whether how that is needed, how urgently that is needed. I met a boy, he was around 12, and in some conference I was making a presentation, do's and don'ts, and I was talking about importance and how it is absolutely necessary to, introduce the disability of the child to the class fellows and they know about it and all. And this boy objected and, argued and then kind of convinced me that first ask the child whether, his disability needs to be discussed, convince the child the positive side of it and ensure that, his or her dignity is not compromised. And the life post-diagnosis should not be difficult. The whole purpose of getting diagnosis done is making life simpler. And if the diagnosis is playing the, the other way around, then we failed. We all failed there. So include the students and look for special school. We must not do that immediately. I know the diagnosis and now let me help the parents and, arrange for his admission in special school. No. Or, oh my God, really, he has moderate hearing loss, so I'm not going to give him less marks or let him just go ahead. No, not that kind of sympathy. They don't want it, they don't like it, and they don't deserve it. This is the summary from 70 to 10 to 12, 4 to 5, and then if there is a child with disability, maybe 1 or 2 in the class of 70. Again, less likely, but some numbers to help you understand. So this is that tool which I already said. Yeah, that's my last thing, that if you want to use this tool, which is available in English and Marathi, if you want to copy, if you have doubts, you need training and workshop for the teachers, you need to try, if you want to translate this in Bengali, Gujarati, Hindi, whichever language, please feel free to connect, and we would love that. Anybody wants to use this tool for research or just want to give feedback, please take a pic. This is my email ID. You can. Thank you once again for patient listening, and I hope there's something that I could reach out to all.
Thank you. Thank you for a lovely session.
Thank you so much.
Thank you. It was a very lot of things to be learned here.
Thank you, Asmita. Thank you so much for doing this for us and for suggesting, as I said, you are as a consultant, All I had to do was call you and tell you we want to do something in June on learning disability, and you came up with this. So thank you for suggesting this. Join our ever-growing Building Back Better community on WhatsApp and follow us to stay up to date on our Building Back Better series.